It's a new start today. Time to find your way in our health and social care system. It will be exciting and challenging. You might make some mistakes, and you might need a bit of luck and time to get the right fit for you. I know I certainly did. When I qualified as an RMN, I started to find my way by moving to London. I set off in the bus with two rather large leather suitcases. They were about the same weight as me. And after around about 10 hours travelling with maps in hand, I finally arrived at Denmark Hill Station. And this was before we had Google Maps or iPhones. So I leave the station, I make my way following the map. It takes me about 20 minutes, 25 minutes to get to the hospital. I could barely lift my arms up, and I was in a very sorry state by the time I arrived. And then when I arrived at the hospital, I was taken to my flat. That was about another 15-20 minute walk. And by the time I got there, I was just about ready to give up, asking myself, gosh, why have I came down here to London? What am I doing? So I got to my room, put my cases down, opened the curtains, and found this train station right in front of me, with a really nice pathway right to my flat. And I thought, so this is how it's going to be in London. So finding my way in London was just like that. It was up and down, it was full of excitement, fear and fun, but it was so rewarding. I went there to learn, to build on what I'd experienced during my training, to see some of the best research and evidence-based nursing practice of any kind, and of course to grow up a little. And after a few years and some exciting roles, I found my way back to Lanarkshire, and I moved into the voluntary sector and undertook my social work training. And for over 30 years now, the voluntary sector has offered me the opportunity to campaign, develop and drive forward change and improvement in the lives of people with mental health problems, learning disabilities and dementia. I'm extremely pleased to have found my way to it. It started with a blank sheet and a new mental health community project for Lanarkshire Association for Mental Health. We developed some amazing initiatives and projects. And following on from this role, I was privileged to work with Enable for 10 years. And during this time, I led the development team. This was an exciting time as we played a key role in transforming the lives of many hundreds of people with learning disabilities who had lived in hospitals for decades. Finding a way to hand someone their keys to their own house after decades of institutional care is something that will live with me forever. Just like finding a way to help people with learning disabilities find jobs, find relationships, and find a good life as an equal and valued member of society will never leave me. As my role evolved, so did my desire to lead an organisation. But again, I realised I needed more knowledge, and I found my way to Glasgow Caledonian University. And I enrolled in the MBA programme, inspired by the principles and values of this university. The commitment to the common good, the desire to make a difference across all communities, and a deep understanding of the third sector was perfect. And I'm extremely proud to be an alumni and indeed to have received an honorary doctorate from this university. The skills and knowledge that I learned from my MBA helped me find my way to my next challenge. I started working as Chief Executive of Alzheimer Scotland 15 years ago. At this time, in my view, dementia policy and practice was behind the person-centred practice revolution that had been taking place in other areas. The cloak of discrimination and stigma that shrouded dementia was long and dark, and a lack of hope and belief that someone could live well with dementia was widespread in our health and social care system. So along with many committed colleagues and committed partners, we had to find a way to change this. And I believe we did. We combined the voice, hopes and expectations of people with lived experience and their carers with best practice and research to design new models of transformation and innovation. We developed new approaches to improve diagnosis and post-diagnostic support. We introduced a Charter of Rights and drove forward a human rights-based agenda, and we campaigned for all of it to be included in the government dementia strategies as they emerged. We challenged, disrupted and changed the paradigm of dementia care away from a solely medical model to a person-centred biopsychosocial model. We invested directly in the NHS by creating 14 Alzheimer Scotland nurse and allied health professional consultants, and they have supported over 1,000 trained dementia champions and worked towards new standards of care and indeed the Promoting Excellence framework. We found a way of shifting the dial within the NHS and making dementia everyone's business. We made it possible to believe that you can live well with dementia, and we backed this up with direct support and service innovation. In 2008, there was only a small handful of post-diagnostic link workers in one area. Today we have over 110 link workers across Scotland, and every person has a guarantee of receiving this vital form of support when diagnosed with dementia. We found a way to take dementia to the high street, opening up 24 dementia resource centres in towns across Scotland. And every day we have pulled a little bit of the cloak away, bringing dementia out of the shadows and giving people the chance to live well. It has been a remarkable transformation because we found a way across our dementia community to work together, to work in partnership and to deliver better lives for people living with dementia. The pandemic left a horrific toll on our community, and that is why we must find a new way of rebuilding and finding hope for the future. For us, that hope will lie in many of you. We know that there is the potential to prevent up to 30% of dementia. We now understand that dementia is effectively untreated brain disease. Alzheimer's disease is the most common. There is great hope in research, and there are new drugs that will be disease-modifying that are indeed finding their way into our care system. Our new goal is to find a way of ensuring that we as a country understand and know how to look after our brain health. Our work in Brain Health Scotland aims to make prevention possible. We are working with school children, communities and our NHS colleagues to move our understanding and intervention forward by years. Imagine if we could help just 10% of this group prevent dementia. That's 10,000 people. We must and we will find a way to achieve this. It only feels like yesterday that I took the long way and indeed the wrong way to find my way in London. At some point, you will all do that, but you will learn from that. You will learn to keep going, no matter what the challenges you face. You can find a way. You will learn to search out knowledge and experience, and you will also learn that all of our journeys are made easier when we don't go it on our own. You will learn that sometimes we need to go the long way and there is no shortcut, but never, ever give up on your goals and your dreams and your belief in yourself. In the end, you will always find your way, and I'm sure that will be the most worthwhile and rewarding professional career that is possible. Good luck and enjoy every moment finding your way forward. Thank you very much.